We are currently in the midst of the deadliest drug epidemic in U.S. history. In 2016, 64,000 Americans died from drug overdoses, driven by a dramatic rise in the abuse of opioids like OxyContin, heroin, and fentanyl. But what causes addiction to opioids, and why is it so challenging to treat? That's the subject of a new episode from Nova premiering this week. Nova Addiction takes a look at the ways that opioids affect the brain and at the treatments which have proven to be the most effective at saving lives. The film is also a highly personal look at a slow-motion disaster that's destroying families and entire communities. Here's a preview.
Individuals struggling with addiction are actually battling millions of years of evolution because our brains are exquisitely evolved to seek rewards.
It's those cravings, the inability to stop.
A dangerous cocktail of biology and medicine, made deadlier by a drug 100 times more potent than morphine.
Fentanyl is super toxic. So you get a batch that comes on the street that's a little bit hot, and on those days, it's like bam, somebody's going down, bam, somebody's going down, bam.
As part of our special programming on the opioid crisis made possible by the New York State Office of Alcoholism and Substance Abuse Services, we are now joined by the writer, director, and producer of Nova Addiction, Sarah Holt. Sarah, welcome to the program.
Thank you for having me.
So, Sarah, I know this is a big question to begin with. You could take up the whole half hour of the show, but I have to ask, given what you've learned in the course of making this film, what are the key factors that have led to this opioid crisis?
Well, I think it's incredibly complex. I think it began with the overprescription of painkillers. I was in West Virginia, and I learned that over a 6-year period, 780 million highly addictive pain pills were shipped to the state. There are only 2 million residents. That's 400 pain pills for every man, woman, and child. And so, I think that really started off an epidemic at the same time when the medical profession was beginning to treat pain as the fifth vital sign. Today, people are much more judicious prescribing opioids, but that was the beginning of this crisis.
I think the documentary makes a very compelling case that it is now a disease, a medical condition. I wonder if you could talk to us about how exactly opioids affects the brain.
Sure. So, one thing that all drugs of abuse have in common, including opioids, is they release a chemical in our brain called dopamine. Dopamine, you need dopamine to get out of bed in the morning. Dopamine tells your brain to pay attention, that something important just happened. So if you eat ice cream, you make love, your brain is saying, do that again. It's important for your survival. And, drugs raise our dopamine levels up to 10 times higher than normal. They are some of the most powerful experiences your brain can have. And they leave memories that are incredibly hard to forget. And that's one reason that it's so hard to break the grip of addiction. Just like you never forget how to ride a bike or the birth of your first child, you almost never forget addictive behavior.
So you take a science-based approach to treatments, and you cover very well what works and what doesn't work. Tell us what you found.
Well, one of the things we found, and the evidence was really striking, is that when it comes to opioid use disorder, abstinence-based treatment programs are not particularly effective. They have an 80 to 90% failure rate. And we have very effective medications right now, fortunately, that are helping people get better. Methadone, Suboxone, Naloxone, also called Vivitrol. These medications cut the risk of overdose death by about half. I know a lot of people say, oh, you're just replacing one drug with another, but that really, it's not really fair to say that, because the definition of addiction is consuming drugs compulsively despite negative consequences. When people are given these medications, they no longer are getting high, they stabilize, they can go back to work. They're not pursuing these negative behaviors that characterize addiction.
So that is the position that the documentary clearly shows, and the doctors that you profile clearly say that that is the case. Is that not yet the consensus in the medical community?
You know, only 4% of the nation's doctors can prescribe a drug like Suboxone. It's not widely available. We have emergency rooms across the country where people have been revived from overdoses by Narcan, which is an amazing drug. It saves lives. And then patients go into acute opioid withdrawal, a very painful condition where they're going to be racked by cravings, very, very sick, and most likely go back out and use again. We should be using, these situations in ER rooms to put people on Suboxone, and only a handful of emergency rooms across the country actually are providing this kind of treatment. For a long time, addiction has not been part of the medical system. We don't treat addiction like other chronic diseases. And given the fact that overdose is the leading cause of death for people under 50, to me, that's just untenable. We need to embrace addiction and bring it into the medical system. Families are left to navigate a broken system of care, pay an exorbitant amount for a lot of treatment that really isn't based on science, that's setting their loved ones up to fail and relapse. The sad thing is that we are paying for it anyway.
Yeah.
The costs are unsustainable. We're spending $1 trillion a year on our economy, let alone the human toll. And I really think it makes much more sense to treat addiction.
All right, Sarah. Well, thank you so much for sharing that with us today, and thank you for your documentary.
Thank you. Thanks for having me.
Nova's Addiction premieres Wednesday, October 17th at 9 p.m. on 13.